Alcohol use disorder, AUD, is a progressive illness that involves problematic patterns of behavior related to alcohol consumption that result in clinically significant impairment. AUD can involve binge drinking, which is 4 or more drinks on one occasion for women or 5 or more drinks on one occasion for men, heavy drinking, which is more than 8 drinks per week for women or more than 15 drinks per week for men, drinking while pregnant, or any underage drinking. As many as 60 million Americans engaged in binge drinking in 2021 and 16.3 million engaged in heavy drinking, according to the National Survey on Drug Use and Health. Approximately 29.5 million people over the age of 12 were diagnosed with AUD in the last year, representing 10% of the U.S. population. Further, AUD is associated with a myriad of other health conditions, including psychiatric illness and cancer. Peer support work involves the use of trained peers or individuals with lived experience who have undergone training on how to utilize their lived experience to help others. This work has demonstrated efficacy in substance use treatment, efficacy and adherence, and has gained popularity in recent years. My proposal would be to increase the presence and utilization of peers in the psychiatric, clinical, and medical settings. Peers are often utilized in emergency psychiatric settings. However, the use of peers in an outpatient setting may help to support treatment for AUD earlier in its etiology. It may also reduce the reliance on hospital emergency departments. Clinical professionals can screen for problematic alcohol use using a screening tool like the Alcohol Use Disorder Identification Test, or AUDIT. Those who screen positively for AUD and who express receptivity could be connected with a peer support team. The peer support team would then provide case management services geared towards addressing the substance use disorder specifically. The workforce for this already exists through national organizations like the Mental Health Association, which may have regional offices which could coordinate with physician and clinician offices to provide peer support. The goal of this intervention would be to encourage engagement with treatments for AUD, but to also provide continuity of care and to encourage treatment adherence in the clinical mental health and primary care setting. This intervention would also reduce stigma associated with seeking treatment for AUD, especially earlier in the disease etiology. This intervention would require collaboration on the part of clinicians, physicians, nurses, and peer support workers to ensure success.